I would like to acknowledge CDC, the World Health Organization, and Clinical and Laboratory Standards Institute for putting together these slides. Learning objectives. At the end of this activity, participants will be able to explain the importance of a quality management system, list the quality system essential elements, describe the history of development of quality principles, and 4, discuss the relationship of this quality model to ISO and CLSI standards. And so, what is quality? All aspects of the laboratory operations must be reliable, and reporting must be timely in order to be useful in a clinical or public health setting. Laboratory quality can be defined as accuracy, reliability, and timeliness of the reported test results. The laboratory results must be as accurate as possible. Laboratories produce test results that are widely used in clinical and public health settings, and health outcomes depend on the accuracy of the testing and reporting. If inaccurate results are provided, the consequences can be very significant. Unnecessary treatment complications, failure to provide the proper treatment, delay in correct diagnosis, additional and unnecessary diagnostic testing. These consequences result in increased cost in time, personnel effort, and often in poor patient outcomes. When making measurements, there is always some level of inaccuracy. The challenge is to reduce the level of inaccuracy as much as possible, given the limitations of our testing systems, especially in Africa. An accuracy level of 99% may, at first glance, appear acceptable, but the resulting 1% error can become quite large in a system where many events occur, such as laboratory testing. In France, for example, a 1% error rate would mean that every day 14 minutes without water or electricity would happen, and that there would be 50,000 parcels lost by postal services every day, and that every day 22 newborns would fall from midwives' hands in a hospital somewhere. It would also mean that every day 600,000 lunches could be contaminated by bacteria in a restaurant somewhere. It can also mean that there would be 3 bad landings at Orly, Paris airport, like this one right here. And this is a result of a 1% failure. And so, in order to achieve the highest level of accuracy and reliability, it is essential to perform all processes and procedures in a laboratory in the best possible way. The laboratory is a complex system involving many steps of activity and many people. The complexity of the system requires that many processes and procedures be performed properly. Therefore, the quality management system model, which looks at the entire system, is very important for achieving good laboratory performance. There are many procedures and processes that are performed in the laboratory, and each of these must be carried out correctly in order to assure accuracy and reliability of testing. An error in any part of the cycle can produce a poor laboratory result. A method of detecting errors at each phase of testing is needed if quality is to be assured. ISO standards, that is the International Organization for Standards, it groups laboratory processes into pre-examination, examination, and post-examination categories. Comparable terms in current laboratory use include pre-analytic, analytic, and post-analytic processes, or pre-test, test, and post-test processes. The complexity of the laboratory system requires that many factors must be addressed to assure quality in the laboratory. Some of these factors include the laboratory environment, quality control procedures, communications, record keeping, competent and knowledgeable staff, and good quality reagents and equipment. And so, how do we achieve excellent performance in the laboratory? We need to address all the 12 quality system essentials: organization, personnel, equipment, purchasing and inventory, process control, information management, documents and records, occurrence management, assessment, process improvement, customer service, and facilities and safety. The definition of quality management system. A quality management system can be defined as coordinated activities to direct and control an organization with regard to quality. This definition is used by the International Organization for Standardization, ISO, and by the Clinical and Laboratory Standards Institute, CLSI. Both groups are internationally recognized laboratory standards organizations and will be discussed later in this lecture. In a quality management system, all aspects of the laboratory operation, including the organizational structure, processes, and procedures, need to be addressed to assure quality. The entire set of operations that occur in testing is called the path of workflow. The path of workflow begins with the patient and ends in reporting and results interpretation, as shown in this diagram. The concept of the path of the workflow is a key to the quality model of the quality management system and must be considered when developing quality practices. For example, a sample that is damaged or altered as a result of improper collection or transport cannot provide a reliable result. A medical report that is delayed or lost or poorly written can negate all the effort of performing the test well. The 12 quality system essentials, which I mentioned earlier, also known as the QSEs, are a set of coordinated activities that function as building blocks for quality management. When all of the laboratory procedures and processes are organized into an understandable and workable structure, the opportunity to ensure that all are appropriately managed is increased. The quality model used here organizes all of the laboratory activities into 12 quality system essentials. These quality system essentials are a set of coordinated activities that serve as building blocks for quality management. Each must be addressed if overall laboratory quality management is to be achieved. This quality management system model was developed by CLSI and is fully compatible with ISO standards. Assuring accuracy and reliability throughout the path of workflow depends on good management of all of the quality essentials. And so in the next few slides, we are going to discuss each of these QSEs, starting with organization. In order to have a functioning quality management system, the structure and management of the laboratory must be organized so that quality policies can be established and implemented. There must be a strong supporting organization or organizational structure. That is, management commitment is crucial, and there must be a mechanism for implementation and monitoring. Looking at personnel, the most important laboratory resource is a competent, motivated staff. The quality management system addresses many elements of personnel management and oversight and reminds us of the importance of encouragement and motivation. As far as equipment as a quality system essential is concerned, many kinds of equipment are used in the laboratory. That is important to note. Each piece of equipment must be functioning properly. Choosing the right equipment, installing it correctly, assuring that the new equipment works properly, and having a system for maintenance are all part of the equipment management program in a quality management system. Purchasing and inventory. The management of reagents and supplies in the laboratory is often a challenging task. However, proper management of purchasing and inventory can produce cost savings in addition to assuring supplies and reagents are available when needed. The procedures that are a part of management of purchasing and inventory are designed to assure that all reagents and supplies are of good quality and that they are used and stored in a manner that preserves integrity and reliability. Process control. Process control is comprised of several factors that are important in assuring the quality of the laboratory testing processes. These factors include quality control for testing, appropriate management of the sample, including collection and handling, and method verification and validation. The elements of process control are very familiar to laboratorians. Quality control was one of the first quality practices to be used in the laboratory and continues to play a vital role in assuring accuracy and testing. Information management. The product of the laboratory is information, primarily in the form of test reporting. Information or data needs to be carefully managed to assure accuracy and confidentiality, as well as accessibility to the laboratory staff and to the healthcare providers. Information may be managed and conveyed with either paper systems or with computers. Both will be discussed in the section on information management. Documents and records. Many of the 12 quality system essentials overlap each other. A good example is the close relationship between documents and records and information management. Documents are needed in the laboratory to inform how to do things and how to do them well, and laboratories always have many documents. Records must be meticulously maintained so as to be accurate and accessible. Occurrence management. An occurrence is an error or an event that should not have happened. A system is needed to detect these problems or occurrences, to handle them properly, and to learn from mistakes and take action so that they do not happen again. Laboratory assessment. The process of assessment is a tool for examining laboratory performance and comparing it to standards or benchmarks, or the performance of other laboratories. Assessment may be internal or performed within the laboratory using its own staff, or it may be external, conducted by a group of that are coming outside of the laboratory. It could be an agency that is independent. Laboratory quality standards are an important part of the assessment process, serving as benchmarks for the laboratory. Process improvement. The primary goal in a quality management system is continuous improvement of the laboratory processes, and this must be done in a systematic manner. There are a number of tools that are useful for process improvement. Some of these tools are preventive action reports, corrective action reports, risk assessment, stakeholder feedback, OFIs or opportunities for improvement, and so on and so forth. Customer service. The concept of customer service has often been overlooked in laboratory practice. However, it is important to note that the laboratory is a service organization. Therefore, it is essential that clients of the laboratory receive what they need. It is also essential to know who the clients of the laboratory are. The clinicians outside of the lab are clients of the laboratory. The patients are also clients of the laboratory. Everybody who receives services from the lab, either directly or indirectly, is a laboratory customer. The laboratory should understand who the customers are and should assess their needs and use customer feedback for making improvements. Facilities and safety. Many factors must be a part of the quality management of facilities and safety. These include security, which is the process of preventing unwanted risks and hazards from entering the laboratory space. Containment, which seeks to minimize risks and prevent hazards from leaving the laboratory space and causing harm to the community. Safety, which includes policies and procedures to prevent harm to workers, visitors, and the community. Ergonomics, which addresses facility and equipment adaptation to allow safe and healthy working conditions at the laboratory site. In the quality management system model, all 12 QSEs must be addressed to assure accurate, reliable, and timely laboratory results and to have quality throughout the laboratory operations. It is important to note that the 12 QSEs may be implemented in the order that best suits the laboratory. Approaches to implementation will vary with the local situation. Laboratories not implementing a good quality management system are guaranteed that there will be many errors and problems occurring that may go undetected. Implementing such a quality management system may not guarantee an error-free laboratory, but it does yield a high quality laboratory that detects errors and prevents them from reoccurring. ISO 9000 defines quality management as coordinated activities to direct and control an organization with regard to quality. This is intimately related to the definition of a quality system, which is organizational structure, resources, processes, and procedures needed to implement quality management. Quality management concepts in use today had their onset in the 20th century and are primarily an outgrowth of manufacturing and shop processes. One of the earliest concepts of the quality management movement was that of quality control of the product. Sheward developed a method for statistical process control in the 1920s, forming the basis of our quality control procedures in the laboratory. Quality control methods were not applied in the laboratory until the 1940s. Other critical thinkers and innovators, including Arman Feigenbaum, Kaoru Ishikawa, and Genichi Taguchi, added to the concepts. The most recent of importance to the laboratory is Galvin's work on microscale error reduction. And so, quality management is not new. A part of quality management is assessment, measuring performance against a standard or benchmark. The new concept of quality management required that standards be set, and again industry has been in the lead. Using a set of standards established by the US military for the manufacture and production of equipment, the International Organization for Standardization established standards for industrial manufacturing. We know these standards as ISO. The ISO 9000 documents provide guidance for quality in manufacturing and service industries and can be broadly applied to many other kinds of organizations. ISO 9001 2000 addresses general quality management system requirements and applies to laboratories. There are two ISO standards that are specific to laboratories. ISO 15189 2012, defined as medical laboratories, particular requirements for quality and competence. It was developed in Geneva, International Organization for Standardization, and then ISO stroke IEC 17025 2005, general requirements for the competence of testing and calibration laboratories, Geneva, International Organization for Standardization. Another important international standards organization for laboratories is the Clinical and Laboratory Standards Institute, or CLSI, formerly known as the National Committee for Clinical Laboratory Standards, NCCLS. CLSI uses a consensus process involving many stakeholders for developing standards. CLSI developed the quality management system model used in training for QMS. This model is based on the 12 quality system essentials and is fully compatible with ISO laboratory standards. CLSI has two documents that are very important in the clinical laboratory. HS1 A2, a quality management system model for healthcare. Approved guideline, second edition, CLSI NCC/NCCLS document HS1-A2, a document developed in 2004. And also CLSI/NCCLS, also known as GP26-A3, application of a quality management system model for laboratory services. Approved guideline, third edition. There are many other standards organizations and many examples of laboratory standards. Some countries have established national laboratory quality standards that apply specifically to laboratories within the country. Some laboratory standards apply only to specific areas in the laboratory or only to specific tests. The World Health Organization has established standards for some specific programs and areas. In summary, quality management system is not new. It grew from the good works of innovators who defined quality over a span of 80 years. Quality management is as applicable for the medical laboratory as it is for manufacturing and industry. Key messages. A laboratory is a complex system and all aspects must function properly to achieve quality. Approaches to implementation will vary with the local situation. Start with changes that can be easily accomplished and have the biggest impact. Implement in stepwise process, but ultimately all quality essentials must be addressed. Thank you.